Good afternoon, everybody. This is Victoria Lancy from Michigan Center for Rural Health. We're going to go ahead and get started just to be mindful of everybody's time. And I will mute everybody as they come along into our room. Good afternoon. Like I said, my name is Victoria Lancy, and I'm the Rural Education Manager with Michigan Center for Rural Health, and we'll be facilitating this program. I would like to welcome everybody to today's special topics grand round on the HIPAA Cybersecurity update, which is brought to you by ISC and Michigan Center for Rural Health. Before we begin the program, just a couple of reminders. If you're logged into the webinar portion and have computer speakers, you may listen to the audio through them. And you can, if you're listening to the program through the audio number provided, handouts are located on our website for you to follow along. Our website is www.mcrh.msu.edu. Click on the education link across the top, scroll down, find today's date, and there you will see the presentation, an attendance form, and an evaluation link. An attendance form can be mailed, emailed, mailed, or faxed into our office to receive a certificate of participation. And the evaluation must be completed online within 2 weeks or by October 4th. If you would like to ask a question during the program, please type it into the chat box so you don't forget it, and the presenter will address it during the Q&A component at the end of the program. And I will also unmute all of the lines during this point for us to ask questions verbally. Our speaker today indicates no conflict of interest, and the planning committee do not have any conflicts. There's no commercial support for this program. With that, I'm pleased to introduce our speaker, Scott Radica, who is a security and network engineer from ISC and has been in this field for over 20 years. And I'll let Scott take it away from there. Go ahead, Scott.
Okay, hello everybody. Thank you for coming, and I'm going to talk to you a little bit about update in HIPAA. I just want to start out saying, although I'm not trying to scare you, this can be a very scary subject, and I'm trying to present the information to inform you of what's going on. So we'll go to the next slide here. Just a little background of me, like she said, I put this in so most of you can go to the slides and read this later. But quick, I am a degreed electrical engineer and I have a master's in cybersecurity. So, always like to throw, I think we've used this cartoon before, so some of you may have seen this, but it's always a good one. Everybody knows, everybody talks about, oh, we can't talk about the HIPAA. Just wanted to try to get a little bit of lightness in there. Now, this NIST OCR backup data is from 2016 because they haven't had the meeting this year. Every year, NIST, which stands for National Institute of Science and Technology, and OCR, Office of Civil Rights, puts on a conference to talk about the state of the industry and HIPAA. Things that they stressed last year was ransomware and cloud computing guidance, and we all have heard a lot of that. The breach notification rule is always talked about. They talk about breach activity. We'll talk here. Reoccurring issues that they've seen. Again, the BAA's risk assessments, business associate agreement, risk assessment, policies, procedures, and encryption, and then audit patching, insider threat, and backup contingency. Per OCR, one of the biggest things that they were looking at last year was the business associate agreements. People are not understanding that any time that you have protected healthcare information and you're working with another company, you must have a business associate agreement between the people. The other thing that that's not happening as much as should is companies, they'll get the paperwork. The business associate is not a form that you just say yes and assign and forget about it. They're pushing that, hey, not only do you have the business associate agreement, but you're checking up on your business associates to ensure that they're meeting the requirements of the business associate. Now, in the past, ISC and myself have said that business associate agreements should be with everybody. And since then, we've changed the point of view. People need to understand that if you have a business associate agreement with somebody, it puts the burden of HIPAA and high tech on that associate. So it's not something you just want to throw out business associate agreements to everybody. The other thing, people still aren't doing their risk analysis. They're not going through categorizing what's their risk and what they need to do. And then we can read through the rest of the stuff, but they're all similar stuff that we've seen in years past. Breach notification rule was a big thing that they pushed last year, and they're still pushing. Real simple. What is a breach? Safe harbor. You hear in the news all the time where they lost a laptop and they ask it wasn't encrypted. If the laptop was lost and the hard drive was encrypted, per Office of Civil Rights, it is not a reportable breach because you protected the data with encryption. Now, technically, doesn't mean the data can't ever be gotten to. It just means you took the level of security that you need to do to protect the data. Some of the scary numbers, this is just from January to September 1st of this year. There's so far 220 reported breaches to Office of Civil Rights for breaches that had 500 or more individuals affected. Now, the big thing that we're seeing changed here from last year is all of a sudden this year, the hacking and IT incidents has gotten bigger than it has in years past. It's always been big, but it's getting bigger. And part of this reason, we're not sure exactly, other than that there's more people realizing that they need to report it with all the news going on. So it may not be that there's actually more incidents happening, there's just better reporting of the incidents. But you're looking at theft, loss of a laptop or stealing of a laptop, and hacking and IT being 90% of all the breaches. Just so people think about this, this data is pulled off of Office of Civil Rights Health and Human Services website. This is 13 reported breaches involving 500 or more individuals in Michigan. I wanted to push this out because in the past when we did this, there's a breach here, breach there. This is really getting either reported more or noticed more. If I did this presentation, I think in 2015, I would hard find 1 or 2 cases. Looking at these numbers, and you can see some of these names that most of us recognize. If you even look at the bottom of the sheet, the 317, 427, 69, those are from 2016, and then starting at the Covenant Medical Center on January 20th is 2017. So even from last year, they had 4 reported breaches, and this year they already have 9, and we're not done with the year. Again, this is going to September 1st data. 9 HIPAA settlements. Now, what happens is Office of Civil Rights will go through and negotiate an agreement with entities when they violate HIPAA if they deem it's needed. What's important about this, and I'll show a little later, these 9 HIPAA settlements, I think there's a total of 16 HIPAA settlements total in 2016. And in 2016, there's $22 million, almost $23 million in fines assessed. From January to May, and the only reason why this data is from January to May, is so far this year, there has not been another breach agreement since May 23rd of this year. I suspect something big is coming out. Maybe they're working on the Anthem breach. I'm not sure. But the other important thing is when you see these breach settlements that come out the news, they're from breaches that happened so far 2015 or earlier. They're not from something that happened in 2016, 2017 yet. And another big deal is fines collected will fund continued enforcement. A while back, yes?
Well, I spent time with once in surgery, so that. There you go. Yeah.
One of the big articles a while back was talking about, with the new administration about cutting budgets for federal organizations. And yes, Office of Civil Rights and Health and Human Services was proposed to have the budget cut. I don't know where it was, but the article was talking about the enforcement division probably will not have any reduction in staff because the fines collected go back into their budget to help them do things. HIPAA history. Everybody thinks that HIPAA came about with Obamacare, but the original law was passed in Congress in 1996, and you see the date. HIPAA's been around a long time, And all the rules that we live by today are all based going back to the old dates. What information is covered? We get this question. Basically, if you can identify the person in any way and you have something about their health care, it is protected healthcare information. So a lot of people, when I've had this question before, a podiatrist, do they have protected healthcare information? Well, they deal with patients and they have their name and they do a condition with their foot. So yes, a podiatrist is a covered entity and has healthcare information. What about a chiropractor? Again, yes. A lot of the things that we're trying to get more awareness for is a lot of people say, oh, I don't have to worry about that. Well, some of the ancillary services were thinking they didn't have to deal with HIPAA. And in essence, anybody who deals with anything in healthcare has to worry about HIPAA. And again, this is the past, present, or future. It is not something that just happened this year. So if you had a patient 10 years ago, you still have to secure that data or properly dispose of it, if you're allowed to. Privacy rule. Again, this has been a challenge, and I also realized that when HIPAA was written, we didn't have 10 computers in every office or cell phones or laptops. But it's really to protect people's information, because healthcare information is what I call persistent data. It is the information that doesn't change. Your date of birth doesn't change. Your Social Security, for most part, doesn't change. Your maiden name, your mother's maiden name. That's the type of information that all can be important for a hacker use for identity theft, but not something that's really can, or in some cases, easily changed. So we have a bigger goal. Like if your credit card got breached, like in Target, what happens? The credit card company gives you a new credit card number. If your Social Security number gets breached, I think it can be done, but from what I understand, it's not very easy. It's hard to get a new Social Security number, and you definitely can't get a new birth date. Use and sharing a PHI. Now, part of HIPAA is available. It wasn't just protecting the data, but it's also making the available data available for those who need it. So HIPAA does allow you to share information. So the whole story, well, I can't give you that information because HIPAA won't allow me to. You have to be careful, because that in itself can be a HIPAA violation if the other person needs to use that information for treatment, payment, or business operations for the healthcare. One case we've used before, and it's just a good case to represent. Back when we had the Ebola scare several years ago now, they had a nurse that was in the hospital in Texas, and they couldn't get her healthcare record because her doctor's office or hospital says, we can't give it to you because HIPAA won't let us. In that case, they were wrong. That data was needed for the purpose of treatment for the patient. So everybody always say, well, I'd rather be extra secure. You got to be careful and make sure that the data is available. Now, the other thing they put out there, and again, I think this is somewhat scary because it's legalese, there's no hard, they talk about a minimum necessary rule. Now, when I go to the doctor, let's say I'm going to have a mole removed off my arm, I kind of want that doctor to know my whole medical history. Now, in some cases, somebody may not. The story we use here a lot was a patient had some plastic surgery that wasn't dealing with the stuff. That information got sent to the other doctor, and they were upset. There's no good answer for this, but it comes down to using some common sense. If you refer a patient to a cardiologist, you better make sure you make available the information that the cardiologist needs to take care of the patient. Safeguards for protected healthcare information. Now, partly because my background as an Army officer, the number one thing you have to do for security is physical security. If you don't lock the building, you can have the best encryption and the best computer in the world. You didn't secure your data properly because somebody could walk in the building, take the whole computer, and walk out. You still have to make sure you lock up the files, you protect the information. One of the things that I add in physical security here to think about, screen locks on your computer. I mean, everybody has computers, and when you're not touching it for a while, it goes into a screen. It may be important to maybe put a screen lock that when it does that, so that if you have to walk away from the computer, you are physically securing the data also. Technical security, use passwords, desktops, portable devices. Anytime you use a portable device and have protected healthcare information, it is the recommendation from Office of Civil Rights and Health and Human Services. And in fact, they really kind of force it that you should use encryption. And again, that's that safe harbor, it protects you. And lastly, HIPAA is not something you do once a year and forget about it. You need to install a culture of compliance. You need to make sure that every employee, every staff member, and your patients know that this is important. This is people's private information that we don't want to get out there. And again, manage your business associates. It's not just enough to have the agreement. Are you doing a check? Are they doing what they're supposed to do? Because it is your, in a lot of cases, patient's data. So you need to kind of make sure that they're doing what needs to be done. Privacy rule information. Again, this is where that sharing of information, there are reasons you can share the information without getting the consent of the patient. Again, people default, well, I gotta get this form signed before I send it over. You know, that can be dangerous. You're not sharing the information that's needed. And again, minimum necessary rule, you only give as much information as the other person has. I think I'm going the wrong way in my slides, I'm sorry. Okay, HIPAA security risk analysis. I put this slide in here. If you look at that, the double S 164.308, that is section, it's the section under the Federal Code of Register. I think I should have put 45 dot, it's the paragraph. This is a law that's in the Federal Code of Register. Basically, the way the law works, you have the Constitution, then you have the Code of Federal Register. So HIPAA is not a state law, basic state law, not a simple law. It's a law that was enacted and signed by Congress at the highest level. So people saying, oh, I have to do these because of Obamacare. No, this is a requirement that came out, and it's very important that you do a risk analysis if you're either a business associate or a covered entity. And this is why I'm kind of mentioning to people, don't make somebody a business associate if they're not a business associate, they don't have any protected healthcare information. Because if you make them a business associate, you're mandating on them by law that they must do a security risk assessment or they're violating federal law. Guidance on a risk assessment. Now this is an important one to me. A risk assessment, again, like HIPAA training, is not something you should be doing once a year. It's a continuing and ongoing process. The example I can use about this, in March, when the hackers released the breaches, the exploit that NSA had used, that changed everybody's risk out there. Now all of a sudden, your routers and your switches and your internal network have vulnerabilities that you have to look at patching. And this is why I kind of hope people think about this, that don't just do the paperwork once a year to turn it in. Are you looking at the risk to your business? And the risk regards specific protecting healthcare information. Another joke. Yeah, I mean, again, if it's the patient's, their data, you have to be able to share it with it. Covered entity is one of the following. They really break it down into 3 sections: healthcare provider, a health plan, or healthcare clearinghouses. Clearinghouses, I've never dealt much with, but pretty big. But again, if you just look at healthcare provider, doctors, clinics, psychologists, dentists, chiropractors, nursing homes, pharmacies. Health plans would be insurance companies, something along that lines. Now, one thing I'd like to present, and this is what gets non-medical companies in trouble, is if your human resources department deals with workman's comp is kind of like a health plan. So there ends up being companies out there that fall under HIPAA because their HR department is keeping names of the people and the injury they have for workman's comp. So just something you want to think about if you are non-covered entity you start with and you want to store that information in your own human resources department. This is important to think about. Business associates. Some examples, I'll give people a second to read. Okay. Now, this is something that when I first started doing these trainings, I would tell people, make sure your janitorial service is a business associate. Now, it was about 1.5 years or 2 years ago that I finally went to a conference and listened to somebody speak when it finally made sense to me why you don't want a janitorial service business contact. My view, being conservative and in security, was, hey, the janitor might come across protected healthcare information and they need to protect it. What I didn't realize is it part of the janitorial services job, normal everyday duties to deal with protected healthcare information? And the answer for most people, it should be no. There's no reason why your cleaning services need to have access to any of your patient data. So how do you protect yourself? You don't make them a business associate. You make a janitorial service a confidentiality agreement, which now you did not put the requirement of doing a risk assessment. But in that confidentiality agreement, which is a business agreement and a basically contractual law, you can then require the janitorial services to do some basic training about HIPAA in case they do run across the information. So they know if they, in the garbage, they find a patient chart, they bring it to you or your security person, and they understand they can't go tell the world, hey, I found this chart in the garbage at the doctor's office. So they understand that it's not part of their job, but if they do come across it, they have to protect the data. Now, the other thing that does, it also gives you the extra credibility to find out that somebody else failed to do their job because the paper shouldn't have been in the garbage in the first place. And I want to see if anybody has questions. So I ask Victoria if anybody can raise your hand, type something in the chat now, because to me it's really important that you realize who would normally need access and only make those people your business associate. So if you're talking about your billing person, yes, they need access to protected healthcare information because they can't bill without knowing. If you're talking to your dictation services, they would be having protected healthcare information. They know the patient's name, they know information that went in the charts. Those are the companies that you want to make business associates. The companies that don't need to know healthcare information but work with you, I would always do a confidentiality agreement or a security agreement with those people. Okay, policies and procedures. Because our involvement of dealing with clients, this is one thing that ISC and myself are starting to put a more emphasis on. Just because you have a policy and procedure that looks good on paper does not mean you're protected. There have been cases out there that places have the great policies and procedures like a business continuity plan or disaster recovery plan. Everything looks great. I would say, yeah, you're good to go. But real life, a person, they had their business associate agreements, they had their confidentiality, they had their risk assessment, they had their disaster recovery, and this client got hit with ransomware. That ransomware, when they were pulled out their business continuity plan, disaster recovery plan, it ended up not being worth the paper it was written on. So I'm starting to let people know that these aren't, again, they're not do it once a year, sign it, put it on the shelf. They need to be real documents that when an emergency happens, you can pull it up and it gives you a guidebook of how to recover. Now, with everything in the news, everybody understands that ransomware is the new attack vector for most of clients. In the past, hackers, criminals were looking for the healthcare information for identity theft. Now, unfortunately, because in the last few years we've had so many breaches, you have the Blue Cross Blue Shield anthems, there is actually a glutton of information or an oversupply of data in the black market. So a healthcare record isn't worth as much as it was before. So now what the hackers are doing, they're looking at this HIPAA where you have to have the availability and the access to the data, and they're using ransomware. In fact, I heard the other day, there's companies out there in the criminal organization that will do ransomware as a service. So you hear software as a service. And their idea is to stop up your system so you pay the ransom so that you get your data back so you can take care of your patients. If you have a good policy procedure for disaster recovery, you have a good backup procedure, you don't have to pay the ransom. And so they need to be workable and tested and made sure they make sense. So don't just write it, put it in the folder, and never open up the folder again. Me, with my government background, it was always written. If it's not written down, it's not done. I think most of you can apply in healthcare. If it's not in the chart, you can't bill for it. Doesn't matter what the doctor did in the room. It's got to be documented. To me, policies and procedure is something everybody knows, doesn't have to be written down, but policies have to be. I will challenge anybody who says, well, we don't need policies, we have everything in procedure. That usually is not going to fly. We need to make sure people understand that you can have small procedures that are understood with an overall policy that points general guidance. Another big thing you need to do is not only have the policy, but train your staff on your policies and procedures. Make sure they understand it's a tool to help them do their job. It's not the 8-inch thick book that nobody ever looks at. All new hires need training. I would like HIPAA training. You might want to have everybody review your policies and procedures every year, every other year. But you also want to check and do spot checks. Every once in a while, go to an employee and say, hey, what would you do if this fell in the garbage? Do you know what's the policy or procedure to notify us that we had a breakdown in security? A good site to help you with policies, procedures too is healthit.gov. And again, when I talk about audit, that's your testing. Make sure your employees, you don't just have policy procedure that nobody knows, that everybody understands them. Steps to take, and I talk about this a lot, is build a culture of compliance. We must get everybody in our organizations to understand that it is every single person's responsibility to protect the data, to not click on that link of the dancing bunnies because that could be ransomware, to only use the work computers for work. We need to get people to understand in this digital world that there are real risks out there and that it's every employee's individual responsibility to do the best they can to protect from it. And again, make privacy part of daily operations. If you find somebody walk away with a computer, doesn't have screen protector and logged in, talk to them about it, address it, work on it. I like to use some trusted resources. HHS.gov has a lot of good information. They are the enforcers. Health and Human Services of HIPAA. They're the ones mandated with enforcing it. Office of National Coordinator, I know a lot of people. And then healthit.gov is another really good site. Healthit.gov is actually run by Health and Human Services. And then another big information that I use to try to track on what's going on in the world and the environment is the HIPAA Journal. They get out some really good articles. I go there once every day or two to see new articles. They usually put 3 to 4 articles out a week, and they'll talk about the latest breaches. They'll talk about latest rules and regulations, and it's a real simple, easy place to go to find out new information about HIPAA and healthcare that's going on in the industry. Now, this gets down to some of the a lot scary stuff. Just that first heading here, OCR head expects major HIPAA settlement for a big, juicy, egregious breach in 2017. Now, I've already told you we haven't had a breach agreement since May 23rd. I'm half wondering if this big, juicy, egregious breach is what's being worked on, and we're going to hear soon. I expect there to be several more breach agreements come out this year. It's odd that we haven't seen anything since end of May. The other one, the second one that I think is really important for this group in rural healthcare. If you go to read this no business associate agreement, $31,000 mistake, when you go to the article, you'll find out, and this agreement happened in April of 2017. This was a small, I think it was a single or 2 or 3 provider practice. I know for most of our clients, having to pay $31,000 to Office of Civil Rights as an agreement, plus do all the things that they tell you need to do to fix. And the only thing they didn't do is they stored data at a cloud site without executing a business associate agreement with that cloud storage provider. And they ended up paying $31,000 fine for not doing a business associate agreement. So this stuff, it's very, very important, and it can attack the bottom line for everybody, including the small individual providers. The one thing I do want to bring up here, Office of Civil Rights has said that they will not fine somebody out of business. But the joke around us here is that they are really good at figuring out how much will take you to go out of business and charge you $1 less than that. They're going to make it hurt. They're going to make sure you understand that it's your responsibility to meet the requirements and protect the data. There's some other articles. Again, you notice a lot of these come off HIPAA Journal, and HIPAA Journal will have an article that points out to US News and other things. It's just a real quick, easy thing to go to get up-to-date information. It doesn't have everything, but it's pretty good for every day. A little background, ISC, what we do. We've had people in this business 30 years. Just so you understand, we're out there, we're trying to help our clients, and that we do have background in the real industry. That being said, I want to bring up, and everybody see, this is the article from OCR, major settlement, big juicy egregious breach. And one thing I really jumped out at me, which is the quote.
Scott?
Yes.
We can't see the article.
You can't see it at all?
Nope.
We
can just see your
Oh, okay, I got the wrong, here, I'm sorry, I got to move it over. Okay, here we go. Is that a little better?
Yes.
Thank you. Sorry, I had it on the wrong screen. Okay, this is what the article came out, and just came out September 6th from the director of OCR. Now, one of the important things that are interesting to understand, the new director from Office of Civil Rights comes back from the law enforcement side of Office of Civil Rights. And it's really important. It's Mr. Roger Saravino. And this statement right here, he wants to find somebody, a rule breaker, so he can use it to educate everybody else that you should be paying attention. I think that's part of what that $31,000 fine was. They're trying to get out there. It's not just the big breaches of the Johns Hopkins that Office of Civil Rights is going after. They're also looking at these small breaches with the small companies. And this is another quote. He really wants to make sure that people come in compliance. He said he doesn't want to just do people because they're wrong. He wants to balance the law, right above here. I have to balance law enforcement instinct with the educational component. And then here's the other statement where about just because you're small doesn't mean that they're not looking at your information and important. Real quickly, again, this is like HIPAA.HIPAAjournal.gov looks like. Here's a website right here, ocrportal.hhs.gov. This is all the reported breaches to Office of Civil Rights. You can see just alone the most updated, which just came in on the 16th, but just in this last month alone, since the 1st, there's already been 13 reported breaches of 500 or more individuals. And on that one, I'd like to open up for questions. Please ask questions. I think it's important that we start working on this.
I have one question here. It says, would a confidentiality agreement be more appropriate for a cloud storage company than a business associate contract?
This was where it comes down to what data is being stored. If they have access to protected healthcare information, then you need to make sure that they would need to have a business associate agreement. Now, if you encrypt a file that's totally encrypted and then store it at a cloud site, I would say you'd be okay to have a confidentiality agreement that they understand that they can't post your data, they have to secure it. But if you're using a cloud storage to storage a Word file that, yes, it's on your bucket on the website, but it has protected healthcare information in it, I would be looking for business associate agreements. Does that answer the question, I hope?
They said, okay, thank you. We'll now open the lines for all other questions and comments. So all other lines are now unmuted. So if you have any other questions or comments, please feel free either to use the chat or you can ask your question now.
Please, I want questions. Because no question's a dumb question, because if you're thinking of it, there's a good chance somebody else is thinking of it too.
I have another one. It says, do I need a BA for anyone who has to share my wireless internet connection?
Yeah, this is a very important. What are you putting on your wireless internet connection? This comes down to is technically how it's set up. If you're using your wireless Wi-Fi to connect computers for the server for the protected healthcare information, that should not be shared with anybody outside your company, because you can't control what they could open on it. And the difficulty here comes to a risk profile. If somebody's on your internet connection, that means they can go out to a website and possibly bring in some kind of virus or vulnerability that could affect your network that could cause you other problems. If you have a guest wireless that is protected, but it's totally technically and isolated from your network, then that's not a protected network. It doesn't house any protected healthcare information. I wouldn't worry about it. The challenge we get is people get a charter Wi-Fi modem for home, or a small business was. You don't want somebody outside your organization on your network that you're doing your healthcare protected information.
Do you have any other questions, comments?
On the OCR portal, these are reported breaches, not necessarily ones that end up being breached. Is that correct?
That's correct. This portal documents all the reported breaches. And, you know, I glossed over that a little bit earlier. In OCR, the law says if you have 500 or more individuals, you must report that breach to OCR. You must notify the affected individuals, and you have to post it in a public manner. That is what this database is. You have 60 days to do that if you have 500 or more individuals. So, like this case, the state of Alaska, they had 501 individuals affected. Then they had to report that within 60 days. Now, in the past, I saw a breach agreement that cost, it was a larger hospital, but I think it was $2.3 million because they took 90 days and 110 days to report the breach of more than 500 individuals. Office of Civil Rights is really serious about that 60-day timeline, and it says you must report the breach of 500 more individuals 60 days after you discover the breach or should have known the breach was there. So that's the big thing, like in today's news with Equifax. Everybody's talking, well, wait a minute, they knew about this breach in March. Why did they wait till May to report it? That is a big deal with Health and Human Services. The other big thing that people seem to miss, they said, hey, it was only 2 people, I don't have to worry about it. The law goes on to say that for any breach of less than 500 individuals, you still have to report it to Office of Civil Rights, but you have to do it within 60 days of the end of the calendar year that it happened. And you may report all breaches at once if there are 3 individuals. So a case that actually came up big was a HIPAA breach, and actually they got a fine. It was a hospital. They had somebody try to do fraud to get health care with stolen information. Well, the hospital said, use the patient's real name that was frauded, and that was a breach that cost them lots of money because they violated the information. Another case. So just because it's less than 500 doesn't mean you don't have to report it, just means when you have to report it. Does that answer, I hope?
Yes, thank you.
You're welcome.
Are there any other questions or comments for our presenter?
You know, I have a question that was asked of me the other day, and they said, how do you protect from a 0-day vulnerability? And I have to be careful how I answer this. The definition of a 0-day vulnerability that you hear in the news is a vulnerability that the first time you learned about it happen is after somebody used it to breach somebody. So there is no way to defend against a 0-day vulnerability unless it is similar to something else we already know about. So I want to, you got to be real careful, and in this world and the way it's going on with advertising is people use words without understanding what they mean. A 0-day vulnerability is something that nobody knew about it except the hacker, and we learned about it after a breach happened. So by definition, the only way really to protect by a 0-day vulnerability is to do your basic, what we call cyber hygiene. You're doing your updates on your computers, you're doing your patches, you're doing your checking your network, you're not clicking on links, you're training your people.
Questions or comments?
I will just, everybody needs, I am available. I think Victoria has my contact information, and I should have put in a slide. I apologize, I didn't. But if you guys have quick questions or emails, you're welcome to email me in here. What I'll do is,
I do have all of the presenters' contact info, so I can email that out to everybody directly after following the webinar today as well.
I also just put up on the screen, it's just the signature line for my email, if you want to write it down too. Like I said, I believe in security. I think it's important, but it is something that we all have to work together, and everybody work together, you know, to do it. It's not something that, oh, that's the security person. They're the ones to take care of that. I don't have to worry about it.
If we don't have any other questions or comments, we'll go ahead and sign off for the day. Please fill out your evaluation so we can get our presenters some good feedback, and as well as it helps us think of other topics that you guys would like to hear more about. Thank you for joining us, everybody, and have a great day.